Hi there, I'm Dr. Shanna Vidor. I'm with Bois Forte Health Services. I'm the medical director, and I'm here to talk to you a little bit today again about the symptoms of COVID-19. That's that respiratory viral illness that's now circulating widely, unfortunately both in the United States, now some in our county as well, and throughout the world. Just to be aware again, if you would come down with this illness, 80% of people are getting a mild respiratory illness with this and will go on to recover. That vast majority also does not require hospitalization. There are definitely those who are at higher risk for a more severe course, and that would be people that have underlying medical conditions, so things like heart disease, hypertension, diabetes, any type of immunosuppression, meaning the immune system is not is compromised, so it's not working as well as we would want it to be to fight off illness. So again, some of the symptoms that we want you to watch out for should you become ill with this virus. The three primary hallmark symptoms are going to be fever, cough, and shortness of breath. Many people will also feel quite fatigued or tired with this illness. Other symptoms can include muscle aches, headache, sore throat, or in some people diarrhea. We also have had some case reports of people having a decreased or lost sense of smell or taste. If you would notice those symptoms, even if you don't have any other respiratory symptoms, we would ask you to be isolating yourself. Symptoms, if you have been exposed or you are coming down with the illness, tend to happen between 2 to 14 days after you were exposed. There are a small subset of people that won't have any symptoms at all, and they're not likely to be significant shedders of this virus. The reason being is that this virus is transmitted primarily by respiratory droplets, which are the droplets that occur when a person coughs or sneezes when they're infected with the virus. And so that's where the precautions of social distancing, keeping 6 feet between you and the next person. If you're out in an area, if you have to be out to grocery shop, please try to maintain that distance between yourself and others. We also don't recommend everybody piling into a car together and driving down. It would be much safer if you have to go grocery shopping to do that on your own. If you're an elder or you have other high-risk conditions, we're asking you to stay at home and to ask for assistance with grocery shopping or other needs that you might have. We also recommend keeping your hands clean, so hand washing. Make sure you use soap and water for 20 seconds. Scrubbing, making sure you're getting all the surfaces of your hands, backs of the hands, palms, fingernails, thumbs, and even the wrists. And then to dry and use a paper towel if you're in a public place to turn off the faucet if it's not an automatic one. Make sure that you're wiping down hard surfaces, whether if you have to be at work, if you're well, we want you wiping down door handles, hard surfaces, countertops, things like that. And if you're not well, we want you staying home. If your symptoms would become more severe, we certainly want you to contact a medical provider and to discuss whether you need to be evaluated and then go from there. Something very important that I want every person to consider and to know is that all the measures that we have asked of our community, as well as those that have been recommended or asked of us by the Minnesota Department of Health and the CDC, these measures are only going to work if you as an individual will implement them. It's something you have to make a choice to do to reduce your own risk and to reduce the risk of your community. If you choose not to follow those measures, it could have dire consequences for your own health and for the health of your community, including your own family. Please take these considerations, these recommendations seriously. Practice the social distancing. Stay in your home if you don't need to be out and about. If you do, use caution, follow social distancing, wash your hands frequently, try not to touch your eyes, nose, or face, And make sure and look out for your neighbors as well. There are many people who aren't going to be able to be going about life the way they would normally like to. Take those people into consideration, ask if you can help your neighbor, and again, be wise in your choices for yourself, because they don't just impact you. They could potentially, as I said, have a dire consequence for your family, for your friends, and your community. So please take these recommendations seriously. If you have any questions, please do not hesitate to contact our clinics. The Bois Forte Net Lake Clinic, our telephone number there is 218-757-3650. If you want to call the Vermilion Clinic, it's 218-753-2182. And during regular business hours, there's a registered nurse available to talk to you if you're concerned you might have symptoms or you're not sure what to do. If it's after hours and it truly is an emergency, we would recommend that you call ahead if you're having respiratory symptoms and go to your nearest emergency room. Again, if you have questions, there's very good, valid resources available. The Minnesota Department of Health website is an excellent resource, along with the CDC, which is cdc.gov if you're on the internet. There's also hotlines for COVID questions to be answered, both with Essentia and St. Luke, and those are widely available. St. Louis County, I believe, also has a hotline. The numbers are available on the web if you're interested in contacting those resources as well. Within our own community, Terry Morrison, our community health nurse, our lead community health nurse, is an excellent resource, and many of you already know her or have her phone number. Otherwise, as I mentioned, you can certainly call the clinic either at Net Lake or at Vermilion and ask questions. Thank you.